challenges I find are the big question marks as to the future. We have system overhaul, we have governmental changes that are all taking place at light speed, and trying to keep up with those, I think, is one of the biggest challenges that faces all physicians and healthcare providers currently. Surviving in the current environment of healthcare, I think, is largely dependent on your understanding of the process. And each aspect of healthcare has its own processes that have to be analyzed and looked at. We're generally too busy to look at all these in minute detail, so we rely on our staff. But each physician, I think, has to get involved and actually breaking down the information themselves. What I typically would recommend is that you get your sleeves rolled up, open up an EOB or two with your staff, go through those so that you have an understanding of what's going on the reimbursement end of things, but also to get involved on the pre-cert end of things, where you're sitting down with your staff and knowing what they have to go through to be able to get the services that you provide authorized and actually reimbursed properly, and knowing what the process is, not only for that, but for the proper billing and encoding and all those issues that physicians, as I said, are typically too busy to undergo. If you don't have an understanding of that process, the process is going to bite you. One of the things that's critical for any physician to really embark upon is not only to analyze the situation as it takes place in its entirety, from the time that a patient is referred to you to the time that the patient actually walks through your door. If you don't have an understanding of that entire system that you have in place, you don't know where to make corrections. You don't know where to go ahead and really attack a problem. And knowing how to do that from the beginning is going to save you a whole lot of effort on the back end of things, where suddenly you have to backtrack and end up correcting things that have taken place already. It can get out of control, and as a result, really being prepared on the front end of things, I think, is probably more important than analyzing things retrospectively. HR Synergies provided contract review services for our practice and our surgery center, and those were really vital efforts in allowing us to survive the onslaught of changes that are taking place as we speak. Additionally, we had a practice management review of our processes, and within that looked at efficiencies and inefficiencies in our practice so that we could analyze further where we needed to make changes. And that has actually led to us saving a good amount of money, as well as being able to provide better services for our patients in a more timely fashion. For our practice and for our surgery center, the most critical service that was provided was the contract reviews and analyses. We were able to renegotiate with certain payers, and we were able to really achieve new network status that we hadn't had before your expertise was provided. So that really helped us in many aspects to really improve our efficiency. When we look at the services that have been provided and what I term our ROI, or return on investment, we have seen a 25% increase in our bottom line because of the services that have been provided to us through HR Synergies.